There's some weird screen that I cannot.
Afternoon, everybody. I hope you can hear me. My name is Joseph Bartovich. I'm joining from the Migration and Health Program at WHO Regional Office for Europe, and I'm absolutely thrilled to be back. We have done quite a few of these webinars at WHO Europe, but also in Turkey. This is our second one in Turkey, where we're collaborating with a number of colleagues and stakeholders in Turkey. And today also we're joined by the EU delegation. So thank you very much for your generous support and for being with us, and also to everybody else who has been involved in preparation of this event. The webinar is really a continuation of the good collaboration we have had with the Ministry of Health in Turkey. And I have to say that for me, there has been quite a few of these collaborations. So really, Turkey is starting to feel like home for me. So I'm very happy to be here and to meet more professionals and more colleagues who are working in the country. The webinar today is focusing on sustainable development goals, and the aim is to strengthen the understanding and knowledge of SDGs, and in particularly SDGs which are related to health and migration at all levels, from policymakers to frontline healthcare workers. And we hope to share insights, evidence, tools, and ideas related to the implementation of Sustainable Development Goals and furthering the 2030 Agenda for Sustainable Development. So that's it in a nutshell. I'm very excited about the program. After the opening remarks, we will have a keynote address from our colleague Emilia Aragon de Leon, who is working in the Sustainable Development and Health team here at WHO Regional Office for Europe. And after that, we will have an interactive discussion with a number of colleagues who are involved in Turkey in implementing the SDGs. And I would like to draw the attention to the modality as a discussion, and that's why I would like to really invite everybody who is joining us online to pose questions through the chat function of this platform, and we will try to address as many questions as possible during the course of the webinar, and also in the Q&A session towards the end. The second thing I would like to raise your attention to is the interpreting function. The webinar is available today in 3 languages, in Turkish, English, and Arabic. So if you need interpreting, please choose the relevant language. And once you have selected the language, please also use the mute button under the list of languages. It says mute original audio, and this way we'll make sure that you will not get the webinar in 2 languages at the same time. So that's it in terms of housekeeping. So how is it going to work today? This is really a working session. We're here with our sleeves rolled up, trying to figure out if there is a way we can take another expansive step really today in this area of work. We're here to get into the nitty-gritty, to get into the detail, and to have a discussion with implementers of the SDGs as professionals committed towards implementation of SDGs really on the ground. We also try to sort of instigate and inspire creativity, try something new, try to play, and I hope we can get here sort of into an imaginative sandbox really and see what we can create. I hope we will also have an environment here which is encouraging of taking risks, of having conversations and discussions and trying different things and different ideas, because that's really where progress happens, and that's really where breakthroughs happen. So I hope that we will dare to go as far as possible in our discussions and in our ideas, and in terms of creativity as well. Just the last thing I would like to mention, also to come back to, is really the flow of the webinar. We'll be looking and starting with a bigger picture, so looking at the global level, and then sort of zooming into regional and national levels, and specifically looking at the targets which are relevant to the topic, especially target 3 or SDG 3, and then a target 10.7, and really looking at the nexus of SDGs and migration and health. And I have to say that the bar in Turkey is really high. The country, many of you already know, has been through 2 VNRs already, and it has, I think, at every stage emphasized, the country has emphasized its commitment to contribute to sustainable development in Turkey, but also to a sustainable world since the adoption of the 2030 agenda. And we have seen through the VNRs the really strong commitment, ownership, and leadership, which permeates all the way from the top levels, and the lead there is with the presidency, but then also all the ministries, all the sectors, including the Ministry of Health. And sort of that is really clear in terms of that commitment there. But we're also now really shifting focus, and we're looking at implementation now. And I think this is why it's so important to have this webinar and involve you, the audience. People who are online are mostly the implementers. So really important role here to move the agenda forward. And that's why it's great to have you here today and to have a discussion and to see how we can improve both the understanding of the SDGs, but also the roles of all of us in this, making sure that we move the agenda forward and meet the commitments that we have made. So again, a warm welcome to everybody online, to the audience and participants, and a warm welcome to also our speakers. And before we start with the keynote presentation and the discussion, there is opening remarks to welcome from the Ministry of Health. So I would like to say hello to Dr. Kanuni Keklik. Welcome, and over to you.
First of all, if I may extend my gratitude for having organized such a good and quite comprehensive webinar, I'd like to welcome you all to our webinar today. It's a very significant and very important topic, and there are many cooperation fields of cooperation that we are continuing, and there are many partners and administrators and executives here being present with us, and we're very happy to have them here because we will be addressing very good topics. I hope that we will be taking all these good topics one step ahead, and everyone has contributed to taking one step ahead of these topics. And I'd like to extend my gratitude to each and every one of you. From my own field of interest, what are the sustainable development goals? If I may just attract your attention to some of the SDGs without further ado. And first of all, Turkey has already taken some very important steps. And in order to achieve these goals, Turkey has always been in a tremendous amount of effort. And as you can see, this is quite clear and obvious from the indicators, for instance, the mortality, the mothers and the child, and the average life time and the longevity in Turkey. Once you take a look at the numerical indicators in this sense, you see that Turkey has made a progress, and it is seen that Turkey has actualized and materialized some of the steps here. And because some of them are human-centered, we should not really forget that as we're trying to reach all these goals, we have a certain concept, which is cooperation. It's only a result of a strong solidarity and cooperation. And as a result, I mean, our success in order to achieve all these goals is only through by means of ensuring that, for instance, the NGOs, the national and the international and the other international and all the stakeholders, once they get together and if they stand shoulder to shoulder, it's only through that it's possible. And one of the most important topics is that the refugee and migrant health related steps. For instance, once you take a look at the health related steps about the temporary protection series, starting as of 2011, that they've started coming to a country, and then first that there have been some revisions in the health progress and health-related services. First, it was the basic and the primary health care services, and it has been going through some improvements as well. The temporary protection Syrians, for instance, I'd like to also mention about my own field of expertise and their access to health services. Their accessibility to the health services has increased, and in fact, they're trying, and they have the full accessibility, and they have every opportunity to have a full access to the health services available for the Turkish citizens. The WHO and the other NGOs and the other institutions at the level of national and international, these have been carried out at the coordination, under the coordination of our presidency. It has been taken to a certain level. And once we take a look at it, for instance, in Turkey, the refugee health centers are now, they have been integrated to the Turkish health system, and the TP, temporary protection Syrians, they have been benefiting from the family health services and the other hospitals in Turkey, in addition to the health services that they have been receiving from the migrant health care services, and the outputs and the results from all these steps have been very positive. If I may just give an example, for instance, the refugee health care centers, the Turkish Republic has started opening this, and starting as of this very first step by Turkey, this was followed by the cooperation between Turkey and WHO, and under this cooperation, there have been some trainings provided, and as a result of this healthcare services provided by the refugee healthcare centers in a total number of 29 provinces. It was only 20% that they were able to receive the primary healthcare services. And once we take a look at the data as of 2019 and the end of 2019, we see that there is an increase as to the 46% of the Syrians that they have started taking their primary healthcare services. This is in fact well above the average of the Turkish citizens having this support from the primary healthcare services. So this gives us the big picture, a clear picture. I wouldn't like to suffocate you with the numbers and data right now, or the numerical numbers right now. However, while we are introducing their accessibility to the primary healthcare services, we're also undertaking some steps in order to meet certain needs. It's not as if, like, for instance, they're having their accessibility to their health checks or vaccinations, but in addition to these, all the other topics that are covered under the WHO, there are certain and very dedicated and special services, for instance, for the support for the mental health care services and provision of some of the healthcare services at home. These are some of them. Also, there's another disadvantaged group we're talking about within these refugees, and among these disadvantaged groups, it's not only the Syrians, there are certain other irregular refugees as well. So once taking into consideration the entirety of the entire refugees and migrants in Turkey, it becomes obvious how much Turkey actually needs support, how much Turkey has already taken a big step in order to provide the best service, but how much also Turkey needs some support as well. Also, starting as of Turkey, in all the other countries where refugees and migrants are, for instance, all the national, international, and the NGOs and the other institutions should be, and because there's a need, that there should be a support by these national, international, and the other institutions. I wouldn't like to keep my speech very long, and I wouldn't like to suffocate you into the numbers. These webinars are of high importance. We have a certain understanding and approach. Sometimes we may need a shift, and like the perspective, and our perspectives certainly will be enriched by the end of this webinar as well, because we will be having a positive contribution. I'd like to extend my gratitude.
Thank you very much, Dr. Kaniketlik. And also for your opening address, but also for the sort of overview of the situation in Turkey. That's really appreciated. Thank you very much. And now over to my colleague from the country office. Good afternoon, Altin.
Yes, hello. Can everybody hear me?
Yes, we can hear you.
Okay. For you that don't know me, my name is Dr. Eltin Malay. Today, I'm stepping in for our WHO head of country office in Ankara, Dr. Rishad, who sends his apologies for not being able to attend this important webinar due to a very last meeting request to meet at the Ministry of Health. But on his behalf, it is our pleasure to welcome and thank all the participants that have joined us today, especially those from the Office of the Presidency, the Ministry of Health, the European Union delegation in Ankara, and also the UN Resident Coordinator's Office, as well as all the participants that are from the front lines of the refugee and migrant health providers. Turkey, it's a country that took very bold steps to ensure universal health coverage for all the refugee population, despite the additional strains that were put on the health system, and also established innovative and fruitful partnerships with WHO. Today's webinar is very important to underline the spirit of solidarity and cooperation, and also make the global targets of Sustainable Development Goals a reality. To make this happen in the European region, we have the European Program of Work, which draws out a very clear way for us using two key principles. The first one is that of leaving no one behind, which is not a new principle, but the second one is strengthening the health leadership of governments. And in this regard, we believe that today's discussions will provide for clear action points, which we'll put together, collate, and share with policymakers for advancing the dialogue in this area. Now, before I conclude and give the floor to our colleague, Dr. Santino Severoni, who's the Director of Health and Migration in WHO Geneva, I would especially like to thank my colleagues from the EUD Ankara, Libor Bey and Elif Hanım, for funding this event and giving us the opportunity to move a step further in walking the talk. So thank you very much, colleagues.
Thank you, Altin. Thank you, Dr. Kiklik. Nice to see you again after some times, and hello to many friends I see here around this meeting. I'm very pleased, and I accepted with a big enthusiasm the kind invitation of the country office to say a few words for the opening of this webinar for a number of reasons. In my new function, as many of you know, that I moved recently to a global dimension, still we are looking to, and particularly now, we are looking to champion countries to utilize, to really encourage and support, let's say, younger actors, member states, in really simplify their own process of achieving, promoting the health of refugees and migrants. And indeed, we are counting on Turkey. This is a fact. The work that Turkey has been doing on refugee, it's on record and in front of everybody in terms of positive achievement and important element of innovation. And just to name one, above all, the initiative on human resources for health, for example, the inclusion of Syrian healthcare workers in the Turkish health system. Now is a time also to continue this effort to lead and to be an example. And this is my really warm encouragement, but also full commitment to continue this dialogue together with the Ministry of Health, with the country office, with partners at country level, and also with the regional office and partner at regional level. The element of migration, when we are talking about, as a WHO, we are using the language refugees and migrants because that's the way how legally the resolutions and the policy paper have been reflecting the topic in order to try to cover the entire dimension of a very complex and broad piece of population. While the work on refugees has been advancing a lot, we are concerned globally that the work on migrant or health of migration should probably be receiving a bit more attention to advance at least equally on how the way or how we are advancing on refugees' health. And the element of health and migration is very important because we all know how delicate, how politicized or sensitive is the topic. And I'm never get tired to repeat that when we are promoting the health of migrants, we are talking about public health promotion. We are talking about traditional public health and health sector initiatives. We are not intending to enter into the political sphere. But indeed, we all supported member states and the international community, universal values and principles. And this is the time that we need to apply them also to the population of migrants, which situation is improving, but is not yet as we would like to be. And for this, we need champion countries like Turkey. Before to conclude, just one word about SDG. This is also another reason why I accepted with pleasure to say a few words today. The SDG is really a marking point in our work because the MDG initiated years ago, they almost not included, they almost not consider the element of migration. This is today very strongly represented in the SDG, and the SDG being the base for the most important policy development at global, regional, and national level are absolutely an area where we need to work together. We need to invest, particularly looking at the issue of migration, but also the health dimension of migration. Here is coming the challenge. If we look at the SDG 3, we have a huge consensus from the entire world, member states, international agencies, and international environment. But if you're going to scroll down the menu of objective of the SDG 3, there is no precise reference to health and migration. But we have a very powerful entry points as universal coverage, or the preparedness or service provision. And in this, I would like to conclude by spending a word of encouragement. We also have a number of tools, and Turkey, the region, the European region, has been leading in loading themselves of a policy view and a concrete roadmap of action, like the action plan, regional action plan, which later on has been relaunched globally, and today is the driving force to advance the agenda of health and migration. The positive things in all this is also that Dr. Tedros, the headquarter, invested into this area after a number of years of work of countries and regions, so really a bottom-up process. And today is a reality that health, migration, or what I like to say public health aspect of migration, are part of the DNA of WHO, of the public health DNA of WHO, and we are ready to continue to work together with countries, with colleagues, and with international organizations. Thank you, and wishing you a fruitful webinar, a successful webinar. Thank you very much.
Great, thank you very much. And I would like to also say hello to Limer Hlad, who is joining us from the delegation of the European Union in Turkey. Hello, good afternoon.
Hello, thank you for the floor. Okay, it's a pleasure to say a couple of words on behalf of the EU delegation in Turkey. I want to greet all the friends. I don't know everyone because I see that this event has attracted a lot of interest. But of course, Dr. Keklik, Altin, and others that are present. Let me just a couple of words. I am not a medical doctor myself. I have a lot of respect for medical doctors, as I have repeatedly told you. I came to Turkey a year ago, so I have had the pleasure to experience the pandemic situation in Ankara. And when I came here, I discovered a country with a very solid health infrastructure in place that profiled itself as a power in incoming health tourism. So I think those of us that have been in Turkey during the pandemic, we were lucky because facilities are well equipped, are available. There is a lot of qualified young doctors that are dedicated to their not job but to their mission to save the life of the others, taking a high personal risk. So everyone who is working in the front line, great admiration. I have also come here to contribute to the implementation of what is the largest program of the EU in support of refugees in the world. You may know that the EU is supporting refugees not only in Turkey, but globally, both inside the EU, but also in outside the borders of the EU. The facility for refugees in Turkey, in the volume of €6 billion, is the largest program that we have worldwide. So, is of course the first impression is the idea of something great. Is unsurprising that one of the priority areas under the facility is specifically health. This is determined by the fact that the refugees, by the profile, let's say, of the target audience, which are the refugees, they are very often in a, let's say, relatively bad shape. If we want if we are aiming for an opportunity for these people to rebuild their lives and integrating in the host society, whichever society it is, and becoming, rather than a burden for the host society, contributing to the host society, they need to be in both a physical and mental condition that allows that. So around half is an approximate figure of the EU facility has been spent on the area of health. You may know that with the Ministry of Health, we have had one of our flagship projects called SAHAT, is a project that the objective of which is to improve access of the Syrian refugees and refugees in general to quality medical care that they need. Now, how can we say if we are succeeding in facilitating access to the care that these people need? The care that these people need depends on who they are. When we look at the group of the refugees in Turkey, we will see that many of them are very young, and many of them are women of reproductive age. Almost half of them is below the age of 18, and 1/3 has a relatively low level of education and also limited language skills and lots of traumas from their previous lives in Syria. So we are talking about a group that is very fragile, that is particularly vulnerable and particularly affected by additional risks. An additional risk, I'm of course talking about the COVID pandemic that caught us, let's be frank, unprepared to a large extent, and we had to improvise a lot. We have done that together with our counterparts to the extent possible. We have mobilized resources under the Sahat project and under other projects that have been implemented within the regional Madat Fund, is a fund that funds actions for support of refugees in the whole region, in countries that are neighboring Syria. So this has been done, but one obstacle that we have been experiencing over and over is access to the information about what's happening on the ground. And I would like to make a point here, because we can only get things right if we know, if we have a good snapshot of the situation on the ground. This is unfortunately not always the case. Also, as the pandemic unfolded, we were working with more or less anecdotal evidence, information collected by NGOs here and there about what is happening and how the communities are affected. So I think in this direction, there is a lot of work and a lot of room for improvement in the future. The better we will be able to describe the initial situation, the better we will be able to set the objectives of our action and achieve something real. Another point that I want to make, apart from the availability of data about how the communities are affected and about how the situation is developing in Turkey in general, because, for example, I am of course following the data that are officially published, but there are a lot of discrepancies among the data. I would like to pick on one in particular, is for those of you who are epidemiologists, is the number of cases, new cases that are recorded in Turkey daily, and the number of deaths that are unfortunately also recorded. There seems to be in Turkey a big discrepancy between these two numbers. In particular, the number of deaths seems to be disproportionately higher in Turkey compared with some other countries. Is my lay observation, don't take it for granted, but I would like to raise some questions that will hopefully stimulate the debate this afternoon. My other point is the fact that among in the group of the Syrian refugees in Turkey, we are very lucky because some of them are highly qualified medical doctors that have dedicated their life to medicine, and they want to continue in their mission also in Turkey. We have partnered with WHO to upgrade the qualification of these people and prepare them for the continued practice of medicine in Turkey. So far, a large number has found employment in our own program in the SHAT, but we need to be looking to give to these people longer-term perspective. We have started to address this issue with the Ministry of Health and with the WHO, and we are currently finalizing a roadmap of actions that we are about to take in view of facilitating the recognition of qualifications that these people have acquired in practicing their specialization in medicine. So is another topic that that we can address this afternoon. Okay, another last point that I am gonna make, I don't want to monopolize the discussion, is I want to say that there was a question here, will the health program continue? Yes. So SHAT 1 is coming to an end. We are currently working hard with the team of Dr. Keklik to bring SHAT 1 to a successful end and build on what has been achieved under SHAT 1 with SHAT 2. Okay, makes sense. That should be a more sophisticated program with more ambitious objectives that will focus on the priority areas we have identified over the past years. So to get this right, you know, a lot of people are watching what we are doing with the public money. The situation is complicated not only in Turkey, but all over the world. In Europe, you know, right now the situation is dramatic. The numbers are rising across Europe as well. So we need to do the best we can with what we have. So efficiency and monitoring and optimizing our action will be the mantras that will be guiding our action in the months and years to come. So I want to, on this happy note, is a lot of work ahead of us. Is a real pleasure to see that we have a lot of dedicated people around the table. I hope we are working towards the same objectives. Is the sustainable development goal of achieving happy, healthy lives for everyone. So thank you for your attention.
Great, thank you very much indeed for your remarks, for sort of giving us a bit of an overview as well again, and contributing to the overview of the situation in Turkey, what's happening. I hope that we will come back to these points also in the discussion and look at a number of the things that you have raised, including how, for example, COVID is impacting on the implementation of SDGs, and sort of how can we make sure that we actually remain on track and make sure that things don't slip through despite some of the additional pressures. So during the course of the webinar, but also thank you for already starting to answer some of the questions that are coming up in the chat and Q&A forum and on clarification on the plans with the health program. So thanks for that. And on that note, I would like to encourage more participants to post questions and comments in the Q&A or in the chat boxes. And I can see the discussions are already very lively, but feel free to pose your questions. We are looking at them and we'll be coming back to them during the course of the webinar. So now this now concludes the first part of the webinar, the introduction, and we are going to now move straight to our keynote lecture from our colleague Emilia Aragon de Leon from the Sustainable Development and Health team at WHO Regional Office for Europe. So Emilia, hello, welcome to you. And
hello.
Yes, and over to you as well for the
Thank you so much, Joseph. And thank you so much to everybody who has already introduced a lot of what the SDGs. I'm really, really pleased to see that everybody is really committed as well and well informed around the SDGs. So I'm hoping really I will bring some new knowledge to all of you as well and strengthen the efforts towards the SDGs. I'm going to be sharing my screen now. I have a presentation and I'm aware this is in English, but I think everybody also has it in your library, the presentation in Turkish. So please feel free to follow the presentation. It's the same one. And I hope that you can see my presentation now. Yes. All right. So I think you already have introduced some of those indicators. What is the situation of migrants in Turkey? The purpose of what my objective is actually to give you more of a generic picture of the SDG 3 in general. And I think you're in a better position to actually look in your own area of work and figuring out how you are contributing to the achievement of these other health targets within the SDG 3 and beyond as well.
I'm sorry to jump in. Could you actually go into the presenters mode? We can see the presentation, but we see 2 slides. And so, yeah, if you could just turn it into the mode where we can just see 1 slide. I think it will be better when the slides get a bit more busier so we can read. Thank you.
Yes, sorry, let me see how I do that. So how do I change that? I'm sorry, could you please help me? Just how do I change to present?
Share the screen, and I think there will be options there. It was fine in terms of sharing the screen, so that worked. So there's just a button that you might need to press.
Share screen and okay, I think it's here.
Yeah.
And let me see if you get it now.
Yes, perfect. This is
all right.
Fantastic. Thank you.
Thank you so much for that. All right. So yes, so I'm looking forward to explain to you a little bit more about this overall picture, which I'm sure some of you are already aware of. And in terms of like the indicators around migration and health, I think also that's something I'm looking forward also to hearing from the rest of the panelists. So if we go and looking, as was mentioned before, the life expectancy in Turkey has improved as everywhere else in the region. All around the world, we've seen huge advances in life expectancy, but we know as well that beyond those years gained, there's a lot of disease and a lot of people who are suffering from different diseases as well. So looking at this big picture in gaining life expectancy, we also need to look at those vulnerable groups, looking more in depth into who are not gaining the same amount of life, who is not living a healthy life. And that's also what the opportunities that the SDGs bring with the huge amount of indicators and targets that we have, which can sometimes seem daunting. So I would just like to start by remembering first a little bit more about the SDGs. It's been 5 years since they've been adopted by all member states. Different member states have shown their commitment and their progress, and Turkey has been one of the countries that have already presented, as Joseph said, 2 VNRs, showing a huge commitment to really advance progress on the SDGs. I'd like to remember a little bit of the principles of the SDGs. We talk about people, prosperity, peace, partnership, and planet. And that shows the determination of world leaders to generate a plan for action. And it's really an integrated action. And there's also some characteristics and novelties that allow us to advocate for the different areas of work. There's an unprecedented scope, which means that we can commit other sectors to support our work. It addresses the 3 pillars of sustainable development. There will be social determinants, environmental determinants of health, economic determinants of health that can be addressed. The SDGs are integrated and indivisible, and so we can argue as well that progress in one area will make progress in other areas, and as well as when there's no progress in one area, we cannot make progress in our own area of work. And the inclusiveness and that aim of principle of leaving no one behind supports our work. And the other part that's so important as well is the global nature of it. So we know that also what one country does, what one city does is very relevant, but as long as there's no barriers also, and there's actual support and coordination and collaboration with other countries, we all working under the same vision will support making progress too. So we think of the SDG framework like a system of cogwheels, and in our work around migration and health, we have already identified with the colleagues here that there's a lot of progress that can be made through addressing the needs of migrants. And this is in line also with the vision of Turkey. When I read their VNR, your VNR, it was so interesting to see that indeed addressing the needs of migrants, it seemed as a mechanism to make progress towards ending poverty, towards improving health and well-being, towards improving the economic growth and more inclusive and sustained economic growth, reducing inequalities and allowing for safe migration as well, and as a way of promoting partnership and peace. So this is very important because we definitely see that there's a value in investing in improving the capacities of this vulnerable group. What do we need to do then to actually achieve what we want to do? And this is what I want to focus in my next slides, is the SDGs is not about choosing one or the other intervention, choosing to work in one or the other objective, but we want to see actually transformative change. And transformative change is not linear, like we see in this picture. Transformative change looks more something like this, which can seem as a daunting point at sometimes when we're down in that curve where there's a lot of changes, a lot of disruption, and we have also to face the resistance to change in so many of our partners, of our stakeholders as well. But there's also opportunities in there to adopting new values, new ideas, and create a new situation in which we can achieve our goals. So the SDGs being so large in number and in the number of goals, 70, number of targets and number of indicators, really need of a transformative way in how we approach policy and the implementation. In this way, we have created, and we have been working in the Regional Office for Europe for a way, an approach in how to address the SDGs. And we think that the SDGs are useful to assess, to actually monitor how we're doing with the amount of indicators that are under that guidance. We also have an opportunity to align because we have defined at the global level our visions and our goals. And we have an opportunity to identify accelerators, which are areas of work that will accelerate progress across the board in many different areas, and also to account and make sure that progress is being made by holding actors responsible and that they respond to our progress as well. And through all of these different areas, we can also engage. And it is important for us as health stakeholders to engage. It's important for us as citizens to engage as well. And it's also important for us as humans to engage in the different processes. So let's go a little bit looking at what are the key health indicators in Turkey. And indeed, there's been great successes with the reduction of neonatal mortality, infant mortality, under 5 mortality, maternal mortality. All of these targets are have already been achieved towards the global goal. Out-of-pocket payments for health have also been reduced, which demonstrates the commitment to actually achieve universal health coverage. But we also know that there's challenges behind it. And we know that NCDs are responsible still for a large amount of death in the country. And this is a growing epidemic. We know that the probability of premature death from one of the major NCDs for a person living in Turkey is 1 in 6. This is huge. And NCDs is not only a problem for the individual, but having a large burden of NCDs also reduces economic output. And in terms of quality of care, there's so many challenges as well. There's growing issues as well, such as drug addiction, which is a social problem and also a major health threat as well. So we know that there's still areas of work. And we know there's a commitment to leaving no one behind. In that commitment, member states have recognized that the dignity of all individuals is fundamental, and that the agendas, goals, and targets should be met for all nations and also all people and segments of society. So we need data on vulnerable groups. We need to know what is affecting them. This includes Roma, ethnic minorities, poor women and children, disabled, LGBTI, elderly, and people who inject drugs. And data on these populations is sparse. So indeed, we need to improve data to know what's going on. But we know that there's 5.5 million refugees and migrants. We need to know a bit more. What are the barriers they're facing? What are the other determinants of health around them, and how are they doing in those areas of work? Once we get a picture, a very comprehensive picture, then we can turn into the alignment. And here is a process in which we try to align national, subnational policies, plans, and harmonize all this process to facilitate achievement of the SDGs. This is one of the first steps towards integration as well. And we have to identify in this what are the development priorities and needs, who are the institutions that can act as our partners, who are the actors, what resources we have, and what other factors will influence implementation. If we go and look a bit more into the context of Turkey, we know that the objective of the 11th development plan, these are very strong objectives. It's a stable and strong economy, competitive production and productivity, qualified people, a strong society. So we have here a huge instrument and a huge commitment from the government to improve health. Livable cities, which we know it's a determinant of health with huge impact, and rule of law, democratization, and good governance. And all of these play together for improving health or acting as barriers for health. There's a vision in Turkey in their national health strategy, which is also another instrument that we have for aligning. We know that there's the vision of healthy lifestyles. We also know that there's a mission of protecting human and community health, and this is also coming at the highest level. And there's specific goals and objectives. And the specific areas of focus for the SDGs, according to the VNR, is definitely on the protection of health services and improving healthcare provision. So we have this information serves us as an instrument to ensure the highest level of commitment, but also that there's resources, that there's ways in which we can also align ourselves and our work towards making progress. And as we said, as Joseph mentioned in the beginning as well, there's different mechanisms for alignment. We know there's policies, there's legislations, institutional frameworks that can help us. And there's also the area of implementation. When I see this heat map that was presented in the VNR of Turkey as well, I was very impressed to see first that such a level of analysis has been done as well, that there's a lot of policies covering the areas of poverty, of health, of equality, and peace and partnerships. But there's also gaps in implementation, and that is recognized. And that's why it's so important that people like that you are in here in this webinar today are empowered to understand how you contribute to the SDGs, because now it's also part of that implementation, but also trying to identify what are those barriers that do not allow us to make progress. What interventions will help accelerate progress? And I see that these are the goals of Turkey. So we need to really think in between all of these areas, which interventions will help make progress? How can we improve access to coverage? How can we strengthen primary healthcare? What does it take to actually make sure that primary healthcare services will be accessible in all ways to the people in migrant populations? What will help the country promote healthy lifestyles? What is needed? Is it mechanisms around the commercial determinants of health? Is it regulations, laws? Is it changing prices, fiscal measures, etc.? All of that are different measures that we can tap on in order to make progress. And these measures, I'm really happy to see that it aligns very well with taking a very comprehensive approach towards SDGs. And lastly is around accountability. And here we play roles not only as actors, because we are responsible for delivering a service to the patients, to the migrants and refugees, but we're also responsible ourselves as agents to hold actors to account. And we define agents, which is us as citizens and as people and as humans. And we also have different standards that can be defined that will say what actors have to deliver on. We have our policies, we have the different commitments that can serve us as guidance. We also have the actors responsible for implementation. And then last, there's mechanisms and tools for accountability. And I'll go a little bit more into the tools for accountability later, but here is where I see a huge opportunity to engage. And I took this picture from the Turkish VNR as well. And this is the structure that the government has put together in order to ensure there is inclusion of all sectors of society. So you have the different ministries, part of this presidency organizational structure for achieving the SDGs. We have these councils as well, these different councils on the left side that will that are different mechanisms in which we can engage in our area of work. For example, I can see there's one on healthcare and food policies. There's also some of those that are relevant for us as healthcare actors, our social policies, local governments, because local governments are often responsible for our infrastructures where we deliver our services. And education and training, because we know also that the education sector is a huge determinant of health and can make a huge difference in our children and then when they're adults as well. And the different mechanisms that one can engage in are divided in these areas. So we know that there's ways in we can work with the government institutions, and these are around budgets, public financial systems, the parliamentarians that represent us, engaging with our local authorities, and these designated SDG bodies by the government. And there are also formal processes, which are like these voluntary national reviews, which are processes in which we take stock on what's the progress, what are the gaps, what are the challenges. And this is not about punishment or not, it's more about seeing like we're not making progress here, what do we need to do in order to release those bottlenecks. We also have the international human rights mechanisms, inclusive governance consultations. There's legally binding treaties as well, like the international health regulations, where there's legal commitments as well, and other law reforms, strategic litigations, and other forms of legal measures. And I like to also focus on this area of working on oversight for accountability, which was mentioned already, and the need for using and improving data. And this is not just about numbers, but it's also trying to open a bit more beyond the official statistics and look into the different groups that collect data, civil society, and like as was mentioned also by the other colleague from the EU, the civil society have collected data, they collect stories, there's people behind those data, and this is so relevant when we're trying to work with accountability as well. So it's not just about numbers, it's also about the people behind those numbers. And there's also informal processes in which we can participate, which is like publishing reports. We can engage with the media, we can engage ourselves to raise awareness, making outreach campaigns, and we can raise awareness between our family, between our colleagues, between us and the people that we work with in our community on a day-to-day basis. And then, of course, there's other approaches to accountability, which is when we also have a responsibility as people to keep the private sector accountable, to keep the civil society accountable as well, and to keep other agencies, UN agencies, donors, partners accountable for what they deliver. And that's pretty much from my side right now. I hope that was helpful, and I'm looking forward to your questions and continuing the discussion.
Great, thank you very much, Emilia. I don't think we could have had a better start to the discussions. You have given us this sort of really broad overview, which will guide us now through the rest of the day and the rest of the afternoon and our discussions. I think it was really useful to see the approaches to SDGs, some of the trends, and also explain what the different processes and mechanisms are, both formal and informal, and how actually we can engage in those processes in terms of individual stakeholders, citizens, but also institutions and so on. And I think what also came quite strongly from your presentation is, of course, that we have committed to leave no one behind, and of course there is a huge population group in Turkey in terms of refugees that has to have their needs addressed, but also that there is potential for building their capacities as agents for increasing the overall capacity for advancing progress and making them making refugees and migrants as positive agents who can contribute to also implementation of the SDGs. So thank you very much indeed for that. I have actually a question for you. But before I ask the question, I would like to also highlight that we have a survey for participants. And the first question will be made available now. So just like to encourage everybody to answer live the questions that will be coming up. And in meantime, you can do this while listening to me and Emilia discussing a bit. And I think the question or the sort of area that I would like to sort of zoom in a bit, we have already heard about the sort of very strong progress that Turkey has made. And we have heard about some of the trends which are on the right track in a way, but now we have COVID, and COVID has changed everything. And we've heard it from Libor as well, from the from the EU delegation, that there are sort of additional pressures now. So how do you think we can make sure that we stay on track, both nationally, but also sort of in terms of the bigger picture as the world? What sort of tips do you have for that?
Oh, thanks for that question. It's a very, very interesting question indeed. And I did not touch around COVID and the situation of COVID. But indeed, this is something we know that there's a problem going around the whole world where there's progress being endangered. And there's actually not just stop making progress, but we know there's also a setback. And there's been children who have been locked out of schools. We know there's mothers who have been locked out of services. In some countries as well, there's reports of immunization programs that have stopped as well because of they have been disrupted. And so we know that there might be, there are challenges. But we also see the disruption caused by COVID as an opportunity. And as I showed in that slide with the transformative change, I see ourselves in COVID as with the situation with COVID being in the down in the bottom. You know, at that moment, we have faced a lot of problems. We face a huge disruption, and now we're ready to take back and adopt new values and new set of principles, and can stop doing business as usual and actually have we build back better, as we have heard. And the opportunities that lie ahead are that countries know that this will cause a lot of setback, and they are preparing recovery plans. And we need to engage in those processes of recovery plans and make sure that these processes and these recovery plans addresses the needs of the people that we serve, and that we change the determinants of health, because those processes, those plans will cover economic development that affects the people, will cover access, will cover work. And so it's really relevant processes going on that we need to tap on as citizens, as health stakeholders as well. And normally we don't engage so much in that. So I would hope that we as health stakeholders try to engage more and bring our data and our evidence there into the table to make sure that these things are prioritized.
Great, thank you very much indeed, Emilia Aragon de Leon, for your presentation and for being with us. I'm now going to move on to the interactive webinar session of the webinar. And we have 4 speakers, so I would like to welcome all 4. I would like to welcome Hande Hassima Motulu, who is the head of the Department of Health, Employment and Social Protection, Presidency of Strategy and Budget. I would like to also welcome Esir Bergan Matur, who is the Development Coordination Officer at the United Nations Resident Coordinator's Office. I would like to say also extend a warm welcome to my colleague from the WHO country office, who is the Refugee Health Program Coordinator and who already has extended his welcome to us, Altin Malay. Hello to you as well. And finally, I would like to also introduce Elif Elchi, who is the Program Manager for Health and Facility for Refugees in Turkey delegation of the European Union in Turkey. So it is great to have you all on board. As I said, we would like to make this as interactive as possible. We have had already the sort of overarching presentation and also a great introduction to the situation in Turkey. So really hope to sort of delve a bit deeper into sort of, as I said in the introduction, the nitty-gritty, some of the practicalities and realities of Turkey, and also sort of keeping in mind who the audience is. As I said, also we're talking to a lot of people who are working on the ground, implementing a lot of the work which is, or doing a lot of the work which is contributing to the SDG implementation in the country. So this is a really useful opportunity for them to understand how their work links into the bigger picture. So that's great to have you on board. And I think I would like to start actually with Hande and ask my first question, because you're of course involved in a great part in coordinating within Turkey. So could you just go a bit deeper into the organization of the role of your organization, of your institution in implementing the SDGs? So to start the discussions, please really give us a bit of an outline of the national framework and the key coordinating mechanisms that sort of then translate from the national level all the way to local level, and how the implementation is actually working. Over to you.
Thank you, Mr. Bartovic. Değerli katılımcılar.
Esteemed participants, can you hear me?
Yes,
is there any problem about my voice?
Yes.
Thank you, Mr. Bartovic. Değerli katılımcılar, Cumhurbaşkanlığı
participants, as the Presidency of Strategy and Budget, we have the second progress report, and we have prepared this report and this review report. During the preparation of this review report, the private sector and the NGOs and with the academia, and we were cooperating with them, and we've taken the inputs from the international institutions, UNDP, especially throughout our work. They have provided a great deal of work, and this review report preparation, during this we have held some common and some meetings, and we have reviewed and we have received their input, and this was brought and this was finalized. And in 2019, our country has presented this review report at a higher level, and at the second phase, it really our country is among the first 10 countries to present this review report for the second time, and we're also among the countries to present this report for the very first time in 2016. Leaving no one behind is the motto, and it is the main point of the second review report and our targets for the migrants and refugees. This was especially highlighted in our reports, and especially in our country starting as of 2019, and afterwards we are also facing an migration towards other countries. So one of the fastest response was through health services. And in the current situation, as you might have stated earlier, the Syrians take up the greatest share. And among the migrants, the minute they have stepped into Turkey, they were provided with the emergency health services, especially starting with the vaccination with the children, with the pregnant ladies. And Mr. Dr. Kanuni Keklik has also emphasized, and he has a detailed information on this, because this is actually his expertise and his field of area. I don't want to get into the details of this. However, just we can say this. And the migrants and the refugees' health needs actually is the priority of the health services by Turkey. And in the first term, there was this quite rapid shelter services through shelters through which there were the services, and there were the migrant health services, primary healthcare services, and interior and obstetrics, and the children's and other health services were provided. And the health services are provided for free, not for instance, for the primary and the secondary health care services and the preventative healthcare services. These are all for free of charge. And the primary healthcare services are provided in the family healthcare centers, and the reproductive and the other gender-based violence related services and psychosocial support is also provided. And for the refugee-based health services, this is also linked with the home care services as well. These centers, just as the case in the family care centers, these are all for the community health care services. These are all linked with one another, which tells us that regarding the health services for the migrants, in fact, are covered and are integrated into our country healthcare services. So the healthcare services provided to the migrants is quite integrated, and it's at the exact level of those provided to the citizens. This actually summarizes our motto of leave no one behind. In fact, our country has initially and has in 2008, we have started leaving no one behind motto by means of implementing the overall health care service, trying to take the steps in order to ensure that each and everyone in the country is provided exact the same healthcare standards. So this goes to show that this is the sign that it's provided to each and every one of us at the exact level. In terms of the migrant healthcare services, one physician and one healthcare worker is providing services to one total of 1,000 people, and not only supported by the public budget, but also by the other budgets, and also in order to prevent the language-related problems and the barriers. For instance, the Syrian doctors and the healthcare personnel, they are also employed in the centers, and the trainings to be provided to them are the training is also integrated to the international training. So there is this integration and of the education. So employment of the Syrian doctors is also an important step and factor in order to provide the social cohesion and to provide harmonization and mainstreaming too. And it's important that these are all aligned, and the social support aid and the social aids and the supports are all provided by the DG General Directorate of Migration, and there is an identification number, the ID number, that are delivered to the migrants and refugees so that the services are monitored and they are traceable, and so that it's very important for our institutions to coordinate and that they move together. And this has been brought to a certain level, which actually promises opportunity to take these steps one step further. And for the designing and the implementation of the healthcare services, we need to first ensure that we have the secure data and safe and reliable data. I'd like to tell you a little about the survey that was carried out in 2018, which the results of which was explained and publicized a couple of months ago. This was publicized because the results were already gathered and it was made clear. So as a result of this survey, we have also gathered some data with regards to the Syrians. For instance, there's a sample of the Turkish citizens and there's another sample for the Syrians. So there were two sampling groups, and not only for the Syrians, but also the Turkish citizens, the same and the social data gathering project. We've been gathering this starting from the 1990s, and this certainly is a valuable source of data, not only for the sustainable development goals and the indicators, but also for our own development, other goals or national goals. This is quite aligned with one another. And there are 7 indicators under this survey. And with regards, and at the third goal, we see this family-related goals under this SDG, the national SDG. If I may just mention about a few emphasized points. In 2018, the Turkish population health, and there are, for instance, there are this figures. 93% of the Syrian women are receiving their health services prior to their delivery, and post-delivery they also receive services as a percentage of 90%. And for instance, between 15 to 19 women, 39% of these women have children, and 60% of the Syrian women are obese or a little overweight. And these are a number of indicators that I have picked, but if you can take a look at the report, and you can have an access to this report in the internet, it is the 2018 Turkey Population and Health Research. Allow me to repeat, 2018 Turkey Population and Health Research, 2018. This can be accessible, not only the report, but also with regards to the report, there's a presentation, PowerPoint presentation. There's also the English version of this report. A minute ago, there was this sustainable development goals, 7 indicators of which we have provided, this was provided some data, and this is also in line with our own national sustainable goals. So it provides data, it sheds the light and data to our national sustainable goals. In order to prevent a misunderstanding, if I may just explain, during the 11th progress and the development plan, as we were preparing this, we have prepared, and as I have mentioned a minute ago, there was this 2 review reports, and the content of these 2 reports, as we were preparing in order to use our initiative to prepare these 2 review reports, also because we were among the countries, among those countries that have been categorized as 2009, post-2019. So Turkey has taken the ownership of this process of realizing the SDGs. The data we have are produced by the Turkish institutions, and we also have pursue the aim of increasing the volume and the quality of the data, so that this is in line with, so that all these steps, so I probably think that it's not, it wouldn't be wrong to say that the steps we're taking are also in line with the SDGs of the UN. I wouldn't like to go into further details, but thank you so much for listening to me. If there's any question, I will be giving the time to answer your questions as well.
Great, thank you very much indeed for this detailed overview of the coordination efforts of the presidency. And what really comes out is the whole society, whole government approach and engagement, which is indeed needed for something like this, but such an undertaking as is the implementation of SDGs in any country, I would say. And maybe just first question, if I may, just quickly, if you could cover, and you've already outlined the sort of the coordination mechanisms, and it seems to be really set up well in Turkey. But what do you expect to be the main challenges and sort of next steps in your efforts?
Teşekkür ederim.
Thank you.
Şimdi rakamlarınıza baktım.
First of all, when we examine the figures, of course, I try to emphasize on the figures related to the migrants. But generally, if you ask me the main challenge, we have the population living in the rural area and providing health services for those population living in those areas. And for this reason, we try to put this issue on the agenda of Sustainable Development Plan, and also we try to provide the budget in terms of providing services for the population living in rural area, especially increasing the opportunities for the primary healthcare services. So we try to increase the number of family physician centers and also some other centers in terms of health. This is one of the challenges that we have for our further steps. Secondly, we need to increase the awareness for living a healthy lifestyle. So we try to increase the number of informative activities. We will continue. Of course, we have some introductory activities, but we need to increase these activities in rural areas because we can see those activities in the central provinces, but of course, we need to receive the support of NGOs and also the private sector. They need to be working together with the government. We need their support. Of course, non-governmental organizations, not only for the health sector, but generally, we have, the vulnerable groups. So we need to support these groups more. And also when we consider the populations, vulnerable groups are really important and the support of the NGOs are very essential for us. So we try to provide the support within the scope of our own policies. And for the first time last year, we have conducted a project together with an NGO. So we try to also provide some support for those NGOs for their own actions, because this is not only the issue of health, but this is related to all policies. If we would like to increase the awareness for healthy lifestyle, this is not only the issue of the Ministry of Health. So if I can define as challenges, these two will be emphasized. The first one is to provide services for the population living in the rural area. And as I've stated, in the upcoming period, we have targeted some goals. And secondly, increasing the awareness for healthy lifestyle in the communities.
Great, thank you very much indeed. That's extremely useful. And I'm also asking the secretariats to add the report that you referred to, the 2018 report, to the webinar library. So we will be able to share information and resources with the participants as well. Thank you very much again. And I'm going to now go to Gamze, who is the moderator of our online forum. And I would like to see if there are any questions for our first two speakers. Gamze, over to you. Okay, there seems to be a bit of a problem with the connection, but I can see already, at least in English, there is a question for Emilia regarding accountability. How do you suggest or allow in the mechanisms for NGOs to provide inputs in reporting and in the accountability mechanism. So this is really about engaging civil society and NGOs. Would you like to take the question, Emilia? Thank you.
Sure. Well, thanks so much for that question. And indeed, this is one of the actors as well. The agents of, for accountability are civil society, and the UN recognizing that has created, there's a whole area of accountability where the civil society can contribute, and there's a forum for that. So I'll send the link in that in the chat box. And I will also send to the Secretariat a handbook, which is an SDG accountability handbook. It's a practical guide for civil society to understand better what are those mechanisms and in which ways they can contribute, not just with a shadow reporting, for example, but there's so many other ways in which civil society can contribute as well. And some of that in my last slide, where I mentioned some of those mechanisms, those are also in that handbook as well. So it'll be really, really useful for many of you in civil society to understand. It's not only also at the country level, because again, there's mechanisms at the local level, at the country level, but also at the UN level, there's also areas in which civil society is invited to participate.
Thank you very much, Emilia. And I'm going to now move to our next speaker, and I would like to welcome Esin Gergan-Matur, our colleague from the United Nations, from the Residence Coordinator Office. Hello, and a very good afternoon to you.
Good afternoon.
Yes, good afternoon. So first question is really, we have heard about the situation in Turkey. We have heard about the setup, the institutional architecture, and also now some of the challenges. So really taking it from there, how do you see the role of the UN, and how is the UN trying to address some of these challenges and help Turkey to implement the SDGs?
Before going directly to your question, I would really like to thank WHO colleagues for this invitation first, because we see that this event is really very timely as we are at a crossroads, really, hopefully at a turning point, as Emilia mentioned. Because of the COVID situation, we see a real big setback in the progress towards SDGs. Now I would like to shift to Turkish to continue my intervention. Öncelikle aslında BM'nin SDG'ler konusunda sürdürülebilir kalkınma hedeflerinin gerçekleştirilmesi konusunda neler yaptığına değinmeden önce bizim tabloyu nasıl gördüğümüzde kısaca değinmek istiyorum. Hande Hanım genel olarak Türkiye'nin bu alandaki faaliyetlerinden bahsetti. Ama ben olgusal olarak neredeyiz biraz ona dair bir resim sunmak istiyorum. Aslında Türkiye'nin son yıllarda birçok sürdürülebilir kalkınma hedefi açısından önemli ilerlemeler kaydettiğini görebiliyoruz. Bunlar Türkiye'nin gönüllü ulusal gözden geçirme raporunda da ayrıntılarıyla mevcut. Ben çok kısaca değineceğim burada, zamanımızı çok fazla kullanmamak açısından. Ama özellikle mutlak yoksulluğun ortadan kaldırılması, açlığın ortadan kaldırılması, sağlık, eğitim, temiz su ve sıhhi koşullar, enerji gibi alanlarda hedeflerin büyük oranda gerçekleştirildiğini söylememiz mümkün. Genel ortalamalar açısından tabloya baktığımızda. Yani bu bize sürdürülebilir kalkınma hedeflerinin 1, 2, 3, 4 ve 6, 7 numaralarında aslında önemli ilerlemeler kaydettiğimizi söylüyor. Değinildiği için çok hızlı geçeceğim. Genel sağlık sigortası sisteminin aslında geliştirilmesiyle
the insurance system for the health. So we try to provide the services for all the citizens, and we have provided this insurance system for all the citizens, and there we are going to provide continuous improvements, and we are going to see the solid outputs. In addition,
önemli adımlar
providing services for the refugees, we have taken serious steps. In addition, for the education, for the schooling numbers, we contributed a lot, and we had great improvements in the
çok
last 20
önemli
years.
olduğunu düşündüğümüz bir kazanım
And this is very
okullaşma oranları
crucial for the
açısından
country, especially
özellikle
for the
ilk ve
figures of
orta
the
öğretim
schooling,
seviyesinde
especially for
kız
the
ve erkek
primary and
öğrenciler
secondary
arasındaki
school. And
farkın
when we look
kapanmış
at the
olması.
figures,
Bu fark
we
aslında bir
fulfill the
20 sene
gap between
öncesine
these
dönecek olursak
male and female students,
oldukça
boys and girls.
büyük bir
So when we
farktı.
go back
Ama
to 20
buradaki
years
fark
ago, we can
kapanmış
see
durumda.
this
Bunu
gap
çok önemli bir
is
ilerleme
fulfilled, and
olarak
I believe this is
değerlendiriyoruz.
a
Yine ekonomik büyüme
crucial
ve kentleşmenin çok hızlı bir
improvement.
şekilde aslında
Especially
Türkiye'de
we know
ilerlemesiyle
there is
birlikte
an
enerji ve
urbanization
temiz su
and we
alanındaki
need to
sorunların
provide
da altyapı
energy and
sorunlarının da büyük
clean
oranda
water for the
hallolduğunu ve
population.
nüfusun çok
And
büyük
we
bir
can
kısmının
state
bu
that
hizmetlere
most of the
erişiminin
population can
olduğunu
have the access
söylememiz
for these
mümkün.
too with the improvement in the
Bunlar
infrastructure.
tablonun
These
olumlu
are the
tarafları.
positive
Bütün bu
signs
olumlu
of this
gelişmelerle
picture.
birlikte
But of
elbette
course,
ki
in
bütün
addition to those
ülkelerde
positive
olduğu gibi belli
aspects, as you
alanlarda
know, in
aynı
all
derecede
other
ilerleme
countries,
kaydedilemediğini
sometimes we
de
cannot
söylememiz
have
lazım.
similar
Bu durumda
progresses
ben
in some
spesifik
fields.
alanlara
And I'm
girmeden
not going to go
aslında
into the
yine
specific
değinilmiş olan
fields for the
bir
negative
ilkeye
aspects, but
dönmek
I would
istiyorum.
like to
Hiç kimseyi geride bırakmama ilkesi.
emphasize on the
Bu
principle
aslında bu
of
ilke
leaving
aslında
no one
sürdürülebilir
behind.
kalkınma
This
hedefleri
principle
benimsenirken
is also
bütün
very
BM üyesi
essential for
devletlerin
adopting the
benimsedikleri bir
sustainable
ilke
development
ve
goals for all the
sürdürülebilir kalkınma
countries.
hedeflerinin
And
ruhunu
this will
yansıtmak
also
açısından
be
bunun çok
reflecting
önemli
the
bir ilke
soul of
olduğunu
SDGs.
düşünüyoruz.
This is a main
Bu
principle and this is the
bu
fundamental
ilkenin
one. And
uluslararası
we believe that
düzeyde
this
hiçbir ülkenin
principle
geride
is going to be
bırakılmaması
accepted at an
anlamı var bir
international level.
taraftan.
And this
Ama bir
means
taraftan da
no
ülkeler
one is
içerisinde
like the
hiçbir
countries. No
toplumsal kesimin,
country will be
hiçbir kırılgan
left
grubun
alone
geride
and behind.
bırakılmaması
So
gibi
no vulnerable groups
bir
will be
anlamı
left
var. O
behind and
nedenle biz
alone.
Birleşmiş Milletler
Therefore,
olarak
as the
sürdürülebilir
United
kalkınma
Nations,
hedefleri açısından ilerlemeyi değerlendirirken
when we evaluate
odaklandığımız
the
noktalardan
progress for
bir
the
tanesi
sustainable
de
development
gerçekten
goals,
ülke genelinde gözlemlediğimiz
we try
ilerlemeden
to make our
toplumsal
observations
kesimlerin
at
ne
national
şekilde
level, and
yararlandığı,
we try
aynı
to
ölçüde yararlanıp
understand
yararlanamadığı.
and evaluate how they
Ulusal
benefit from these
ortalamaların ötesine
services.
geçtiğimizde büyük
In addition
ilerleme
to the
kaydedilen
international
alanlarda bile
averages, of
aslında
course, we have some
bütün
areas that we
kesimler
had
açısından
great progress,
aynı sonuçların
and we can
alınamadığını
see
maalesef
similar
ki
results in some other countries.
görüyoruz.
But unfortunately,
Gerek
we cannot
hizmetlere
receive the
erişim
same
açısından,
positive
gerek erişilen hizmetlerin
results
kalitesi
for some
açısından,
other
gerekse de
aspects.
çıktı
Of course, there are
göstergeleri
some less
açısından
progress
hala
in terms of
ilerlememiz
the output, and we believe
gereken
that there are
tabii
some
ki alanlar var.
different fields
Burada
that we
yine
need
önemli
progress
bir
in the
unsur
future.
olarak
And
bu
of course, as an
grupları
important element,
hizmetin eriştirilmesi gereken kesimleri tespit
in order
edebilmek
to
için
have the
aslında
access for all
verinin
those
önemine
services, we need to
değinmek
pay
istiyorum.
attention
Sadece
to
sağlık
the
alanında değil, bütün diğer
significance
alanlarda
of the
alt
data, not
kırılımlar
only for the
bazında, bölgeler
healthcare,
bazında,
but we need
sosyoekonomik
the
kırılımlar
breakdowns
bazında
for the socioeconomic
verilerin önemine işaret
data.
etmek
We need to
istiyorum.
pay attention
Şimdi bu
to this
alanda aslında
data,
gördüğümüz, tespit
information.
ettiğimiz
And
ilerleme kaydedilmesi gereken alanlardan birkaç tanesine değinmek istiyorum.
I would
Örneğin
like
mutlak
to
yoksulluğun
mention
ortadan
some of
kaldırıldığını
the
söyledik.
issues that
Göreli
we need
yoksulluk
to
açısından da çok
improve
önemli
the
ilerlemeler
progress.
kaydedildi.
We
Ama
have overcome
baktığımızda
the absolute
15 yaş
poverty,
altındaki
but
nüfus
when we examine the
açısından, yani
population
çocuklar
under the 15
açısından
years old,
yoksulluk oranının
especially for the
ülke
children,
ortalamasının çok üzerinde
unfortunately,
olduğunu
we
görebiliyoruz.
have
Bu
a
neden
lower
önemli?
average for the
Çünkü çocukluk
poverty. And
döneminde
this is
maruz
very
kalınan
significant. Why?
yoksulluk
Because
ve buna eşlik eden aslında
there
yoksulluk
are some accompanying diseases or there
çocukların
are some
hayat
accompanying
döngüsü
conditions, and
boyunca
this is very
kalıcı
important for the
etkilere
children. There
sahip
could be some permanent impact on
potansiyel
the
olarak kalıcı
children in the
etkilere
future.
sahip
So we need to
olabilecek
consider all those potential
bir unsur.
factors for the future of the children.
Yine eşitsizliklerin
Moreover,
kolayca
we
aşılamadığını,
have the inequalities, so we need to overcome these
önemli
inequalities in the
ilerlemeler
future. But this is of
kaydedildiğini
course
ama
very
son
difficult to
yıllarda
eliminate all of
bu
them.
alanda
We
bir miktar
try to
duraksama yaşandığını
make some
söylememiz
progress, but
mümkün.
we have
Bu hem bölgeler arası
some
gelir
regional and
farklılıklarında hem de
interregional
hane
income
içi
differences, and also we have some
halkı
differences
düzeyindeki
for the
gelir
households
eşitsizliğinde
in our society.
bunu görebiliyoruz.
So we
Sağlık
can see
göstergelerinin
such differences
genelinde
as well.
aslında
For the health
ulusal düzeyde yine
indicators,
çok önemli
we
ilerlemeler
have
olmakla
great
birlikte
progress at
bölgesel
national
olarak
level. But when
sağlık
we examine the
göstergelerinin
regional figures,
önemli
we can see
varyasyon
that there are some different
gösterdiğini
variations
görebiliyoruz.
for the
Yine Hande Hanım'ın
health care.
aslında
And as
referans
Ms.
verdiği
Hande
Türkiye
stated,
Nüfus ve
there were
Sağlık
some
Araştırma
references,
Kutusu
especially
bize bu
it was
açıdan da
stated
önemli bir
the
veri
research,
kaynağı olarak
Turkey
hizmet ediyor.
Population and Health Research.
Bu
This is
araştırmadan
also a very
bölgeler
significant
arasında
document for
bazı
the
çok
figures,
kritik
and we can see there are some
sağlık
critical differences
göstergeleri
between
açısından
different
örneğin
regions.
5 yaş
for the health indicators, for example, maternal mortality, neonatal mortalities, also the development of the adolescents. So we can see there are differences
iyi bir haber olarak okullaşma oranlarında kız ve erkek çocuklar arasındaki farkın büyük oranda ortadan kalktığını söylemiştik.
We have mentioned
Ama
about the
örneğin
fact
buna
that the
iller bazında
schooling rate
baktığımızda
among
bazı
the female
hala
and
bu farkın çok önemli
male students,
oranda
boys and
var
girls, have
olduğunu
changed, but there are
görebiliyoruz.
many gaps and there are many
Bunlar
discrepancies among
aslında bize
the
gerçekten
provinces.
SDG'leri
And this tells us about the SDGs.
başarabilmek
And
için
in order to
ulusal
succeed the
ortalamaların
SDGs, this also
ötesinde çok
tells
daha
us
granüler
that
bir
beyond the
düzeyde, alt
national level,
kırılımlar
we need
düzeyinde
to also have the granular
bakmamız
data
gerektiğini ve en
and the
fazla aslında
breakdown
geride
of these
kalanlara
and what's really left
leaving no one
behind.
behind
For instance,
ilkesi
leaving no one behind
çerçevesinde
is the
kimseyi geride
motto. We
bırakmayacak
should
şekilde
not
müdahalelerde
be
bulunmamız
leaving
gerektiğini
no one
söylüyor. Diğer
behind,
taraftan
this tells us.
toplumsal
And
cinsiyet
the other
eşitliği
thing
Türkiye
is the gender
açısından
equality for
ilerleme
Turkey.
kaydetmemiz
This
gereken bir
is
alan
another
olarak
field
gözüküyor.
that
Ekonomik
needs some
alanda
improvement for
karar
Turkey, for instance, the economic
alma
field
süreçlerinde
and
kadınların
some other
temsiliyeti
economic
açısından
decision
ilerleme
making and the
sağlamamız
representation of
gerektiğini
the
biliyoruz.
women. And
Yine
we know
insanı
that
yarışır
there
işler
needs
büyüme
to be
alanında
some
bu tür
improvement, and
açıklarımız var.
for the
Yüksek işsizlik
other
oranlarımız,
growth,
yüksek
for
kayıt dışılık
decent
oranlarımız var.
growth. And there are some
Verimlilik
other
artışını
employment
devam ettirmek
related gaps,
gerekiyor.
and
Şimdi
we need to
burada
continue
tabii
with the
bir
efficiency
parantez
growth.
açarak
Also,
şunu
if I may just
söylemem
open a
lazım.
parenthesis,
Aslında
if I
Türkiye
may just add,
gösterdiği
for instance,
ekonomik
for
büyüme
Turkey,
performansından
Turkey's economic
sürdürülebilir
growth
kalkınma
performance
hedeflerinin başarılması
and Turkey's,
açısından çok
from the
büyük bir
viewpoint
fayda
of
sağladı.
the materialization of the
Son
SDGs,
10 yıl
Turkey has
içerisinde
benefited what?
aslında
In the
milyonlarca
last
kişi
10 years,
istihdam
millions
sağlandı
of
ama
people have
demografik
been
yapı
employed
dolayısıyla
due to the
daha
demographic
fazlasına
structural
maalesef ihtiyaç
change. We need
var.
further
Bu
of
işler
these improvements,
üzerindeki
and on
baskı
these, the pressure
hala
on the
devam
employability
ediyor.
is
Diğer taraftan
still
iklim
continuing. And
değişikliklerine
the other
son
thing
derece
is the
kırılgan
climate
bir
change
coğrafyada
topic, because we're
yaşıyoruz. Bu
located in a
alanda
very
atmamız gereken adımlar
fragile
var. Bununla birlikte iletişim
atmosphere and
alanında da
fragile geography.
ilerlemeler
And there are some
sağlamamız gereken
other
alanlar var.
points
Şimdi
we
bu
need to
bütün
also
aslında
have some improvement, for instance, for the
değindiğim
geography and
alanlar
environment related
Birleşmiş
points.
Milletler'in
And all
Türkiye
of these points that
hükümetiyle
I have
birlikte
addressed are the topics that have been addressed under the
çalışma
cooperation between
alanlarını oluşturuyor diyebiliriz.
Turkish Republic
Son
and
dönemde
UN
bizim kamu kurumlarımızla birlikte
institution, and
üzerinde
also with
çalıştığımız
the
Birleşmiş Milletler
public
Sürdürülebilir Kalkınma
institutions. We
İşbirliği
have been
çerçevemiz
under the
var.
cooperation
2021-25
framework
yılları
that
içerisinde
we have,
uygulamaya
the
gelecek olan
United
aslında
Nations
stratejik
Sustainable
işbirliği çerçeve
Development
dokümanımız
Cooperation Framework
bu.
starting from
Bütün bu
2021
saptadığımız
to
aslında
further.
ilerleme
And
sağlanması
in order to,
gereken
in line with
alanlar
this
bizim
document and in line with
işbirliği
this framework,
çerçevemizin de
there are
ana
documents, there are
hatlarını
topics, and the
oluşturacak.
fields and the topics have been determined.
Bu uzun dönemli zorlukların yanı sıra
of course we will have the challenges for the long term, but in addition we will have the additional difficulties because of the COVID-19. This is the same case all around the world, and in terms of fulfilling the sustainable development goals, we need to put more efforts. We need to have additional efforts during this period, and sometimes we know this is a very significant period for all of us, and with the effect of this period, we need to have further steps taken in the future.
BM 11 kuruluşu ile birlikte bu
We have
alanların
total 11
hepsinde
institutions, and we try to
gösteriyor.
provide activities in all
Bu
those
alanlarda
institutions
aslında
as we want.
projeler,
And
programlar,
we have the
politika
projects,
diyaloğu
programs,
ve
and the policy
kendi
dialogues.
alanlarındaki
And
uluslararası
in
norm
all
ve
the
standartların
sectors, we have the
savunulduğunu aslında
international
BM kuruluşları
advocacy of the
yürütüyorlar
norms
ve
and the
bütün bu
standards.
faaliyetler
So in all
içerisinde de
those institutions,
2030 gündemi ve
we are going to
sürdürülebilir
have the
kalkınma
2030
hedefleri
agenda and
belirleyici bir
also
kılavuz
identifying
olarak
sustainable development goals.
yer
So they are
alıyor.
all
Diyerek ben isterseniz
available. So I would like to
bu
finalize
soru
my
için
words,
cevabımı
and
sonlandırayım.
this will be the end of my speech. Thank you.
Thank you very much indeed. That's been extremely helpful and interesting as well to sort of further discuss some of the gaps, some of the issues that we need to overcome, and that you have actually through your work identified. Definitely very interesting to hear about the work with children and youth, and sort of the need to focus on the, for example, schooling rates, and also the inequalities that also came from the previous conversation, rural, urban. You also mentioned the interregional differences, and also the differences in inequalities in households, which then have, of course, knock-on effect on other things. So that's great. Thank you very much. And I would like to now invite my colleague from the WHO office, Altin Malay. Hello, Altin. So if you could join us in the discussion and sort of tell us from the WHO perspective, how have you been collaborating with the government of Turkey and contributing to the realization of the SDGs and specifically those targets that are relating to refugee migrant health?
Yes, hello, Dr. Bartovic. I think there is a small confusion in the schedule. I think next in line is Elif Hanım from EUD. I don't know whether you got the latest.
Okay, here we can of course move to Elif, of course. Hello, and I'll save the question for you for later. So Elif, thanks for joining us as well. And similar question to you as well from the EUD perspective. What are the sort of the key pillars of the interventions that you are focusing on to improve access of refugees and migrants to health services in Turkey?
Thank you, Joseph. It's great to be here with colleagues and partners. Actually, EU Facility for Refugees in Turkey prioritize health very much as Libor mentioned. So the specific objective of this priority area is to improve the health status of refugees by supporting the healthcare system in accommodating the needs of refugees in addition to those of the host population, with particular attention to the refugee populated provinces. So within this regard, actually, we support Ministry of Health in addressing mainly the primary healthcare needs of refugee population. So in this process, the regulation on refugees' free access to health services in Turkey and the regulation on permission to Syrian health professionals to be able to work in Turkey are worth to mention to put interventions on a legal basis as well. We believe that these are very important actions to fulfill the needs of refugees, actually. So when we look to the key pillars of our interventions, you know, access to health information and services is key. Therefore, we have supported first infrastructure of health services in primary healthcare by establishing migrant health centers, where Hande Hanım referred as well. So I can say that in figures, we have 178 migrant health centers in 29 provinces with high refugee population. Hence, refugees are able to access health services in their own neighborhoods. So remembering again, access is the key for health services. Following the infrastructure, we have supported human resources of health services in primary healthcare by supporting the employment of Syrian doctors, nurses, technicians, bilingual patient guides, translators, and auxiliary staff in migrant health centers. So now there are over 3,000 staff who are providing healthcare services in migrant health centers. Hence, refugees are able to access health services in their own language. And for ensuring the quality of healthcare service provision, we have supported the training and certification of healthcare workers with collaboration with WHO by establishing migrant health training centers. So all staff in migrant health centers received adaptation trainings on Turkish health system and certified to be able to provide services in migrant health centers in standards of Turkish health system, I may say. So these staff are supported with continuous medical trainings. Hence, refugees are able to access quality health services, I may say. So EU Facility for Refugees in Turkey also supports secondary healthcare services as well with medical devices and staff, as well as construction of 2 hospitals which are ongoing in Hatay and Kilis. So in summary, our actions in this area aims to secure the sustainability of access to comprehensive and quality primary and secondary healthcare for refugee population in Turkey as part of their progressive integration into the Turkish healthcare system, I may say.
Great, thank you very much for this intervention. Just in 2 sentences, would you like to summarize sort of the next steps and plans? We've already heard from your colleague about extending the health program. Anything else that you have in the pipeline?
Yes, actually, I may say that key pillars of our interventions will be implemented in the second tranche of the facility for refugees in Turkey. So there will be two projects which are now under preparation, which is the continuation of Sıhhat 1 as Sıhhat 2. And we are also under preparation of a health infrastructure project. So through these projects, we will be supporting Ministry of Health's efforts. So we really prioritize the integration, further integration of health services, integration of health professionals into Turkish health system, and increase the quality of services. So within this regard, you know, more and more implementation of family medicine system and address-based registration of refugees is key for us. Plus supporting Syrian health professionals to fulfill professional and language requirements and enabling a regularity environment for them is also an important issue for us. So there can be opportunities in public and private sector for them. And about increasing the quality of services, we will continue supporting the strengthening of health infrastructure, as well as we will support increase the specialized services like reproductive health, physical physiotherapy and rehabilitation, mental health and psychosocial support, dental health, continuous medical training for staff, and we will support mobile services for rural areas, as Hande Hanım mentioned, and health literacy programs for more healthy behaviors among the refugees. So I may conclude that we will continue supporting Ministry of Health with our other partners, mainly with WHO. Thank you.
Great, thank you very much for that intervention. Great to, well, first congratulations on the amount of work and the different projects that you have underway, but also it's great to see that actually the linking concretely to the gaps and some of the issues that have been identified in the previous presentations. So that's great to hear. So thank you again, and now over to you, Artin. Hi. So could you just elaborate a bit on the WHO work and how this links with the topic?
Yeah. So thank you very much. And thank you also to Elif Hanım from the EU delegation. I think she did a great job explaining what the EU is supporting the country and what the Ministry of Health and Sıhhat 1 are implementing. And I think that's also our entry point, and I'll explain. So basically, we're talking about primarily SDG 3, which is on health and well-being. And what was described so far, it's basically, you know, furthering the agenda on the universal health coverage, which among others also includes protection from financial risk, but also to a large extent access to essential health services, including medicines. And in this particular case, I'd also want to put vaccines. So how do we do that? Basically, we do that by achieving another objective, which still, I think, if I'm not mistaken, it's objective 3C, which, and I'm quoting, it's basically to increase the health financing, but also the recruitment, development, training, and retention of health workforce. So how does WHO fit into it? In the last 3.5 years, the refugee health program within the country office at here in Ankara basically has been supporting the Ministry of Health to complete what we call the adaptation training of almost 2,200 Syrian health professionals, which were then certified and employed by Sıhhat 1 and were deployed in the network of primary care facilities, 178 that Elif Hanım mentioned, in 29 provinces. They provide primarily primary healthcare services, and this adaptation training was a prerequisite of their employment with Sıhhat 1. On top of the adaptation training, we've also been instrumental in conducting continuous medical education. And so far, I'm happy to say that over 1,000 Syrian doctors, nurses, social workers, psychologists, and other categories have been trained in several topics. And some of the few topics that we are particularly very proud of, or, you know, in a positive sense, we're very happy to have been instrumental. working with the Ministry of Health and other implementing partners, mostly local medical universities, is also the trainings on MHPSS, which stands for Mental Health and Psychosocial Support. And I'm very happy to say that through our cooperation with the Ministry of Health, both Migrant Health Department and also Mental Health Department specifically, we have trained more than 3,300 Turkish and Syrian health and social professionals. We have also made great achievements in training for basic computer literacy and also health information systems. Turkish language is another major component, and only last month we supported the placement exams for the Turkish language for over 1,500 Syrian health professionals. And I'm very happy to also confirm that with support through the EU delegation projects, we have enrolled more than 221 of them in 11 sort of classes that range for courses from A1 to B1. And these are courses basically that will continue for 120 hours for each level. And at the end of those levels, then the certification will enable the Syrian health professionals to be one step closer to full integration in the Turkish system. So I could mention, as Kanuni Bey said, I could suffocate you with numbers, but these are just the highlights of what we've done so far. At this point, I sincerely need to thank the Ministry of Health and our colleagues there, our counterparts, for their strategic vision, for their continued leadership and support and cooperation with WHO and all the other health sector partners in making all these things happen. So that's my response. Thank you.
Great, thank you, Artin. And since you are the WHO representative in this debate, and there has been a lot of already sort of questions around COVID and how will COVID impact on SDG implementation and specifically refugee migrant health in the country. Just 2 sentences or 2 tips. How do you think we could avert the impact of COVID and sort of make sure that we keep progressing?
Yeah, if you'll allow, maybe I'll say more than 2 sentences. It's unfortunate that Dr. Ishad couldn't make it for this meeting because he's the spearheading, not only his acting head of country office, but he's also spearheading the COVID-19 measures in the country from the WHO side. But what I can say is few words about how COVID affected the service delivery in the network of primary care centers and other issues that are related to that. Now, everybody knows, so we're talking about a worldwide pandemic. So COVID-19, it's not just a simple infection. It's basically a public health event of international concern. So it's a major thing. And as such, it doesn't, it doesn't concern itself with divisions in ethnicity or citizenship. So when it comes, it basically affects everybody. So there is no major difference on how the disease affects host populations or refugee populations. But what it does, though, it's that it's a bit harder, or it hits harder the refugee populations, which happen to be vulnerable populations. Now, as you know, when the pandemic reached Turkey, there was clear guidance from the Ministry of Health and also WHO to basically maintain social distancing and telework. And this was done basically to protect both the health workers, but also beneficiaries from the spread of infection. And also, in a way, people were asked not to reach the health centers unnecessarily, meaning unless they had something which was really urgent and COVID related, otherwise they would have to keep their distance. Now, the truth is, we don't have data on how the pandemic has affected the refugee population. And this is very much a very still debated topic in our group. But we can try to sort of understand how the refugee population was affected and whether it was affected harder than the host population. But what we noticed is that in the last 6 months, there was a drop in the utilization numbers, measured basically as number of consultations or visits in the refugee health centers or migrant health centers, which was particular for generally the primary care services, but also with a focus on reproductive and health services. mother and child health services, including here vaccination. And I'm sure my colleagues from UNFPA and UNICEF can confirm that. But not only, we also saw a drop in non-communicable disease consultations, and I'm including mental health here as well. So basically what this accumulated in the last 6 months, it's a considerable unmet health need for the specific services that I mentioned. But also at the end, so if you talk to health workers, at all levels, but also primary care level where our entry point is, you can understand that they're overworked and they're exhausted, and there are increased infection cases among them, at least according to the Turkish Medical Association data. The rate of infection among health professionals is higher than in the general population. And I'm pretty sure it can be explained with the increased exposure to the risk from health professionals. And the other thing that I need to say is that it's not just physical exhaustion or infections, health status, but also it's associated with an increased level of anxiety. I mean, people are uncertain, and business has changed. So it's no longer business as usual, but it's a new sort of normal. And the last point on the pandemic is that, it's not over yet. Even though we have, predictions and promises and vaccines around the corner, the truth is the pandemic is not over. And for us to be able to sort of deal with it, we still need to be around and still need to provide support in terms of social distancing, wearing of masks or other PPEs, and also increasing hygiene and sanitation. So that in a broad term, so that's how all the health sector, health professionals and beneficiaries are affected. But then the refugees are hit hardest. And why do I say that? Because for them, it's not just a matter of health, it's also a matter of socioeconomics. And what do I mean by that? I mean, as a Syrian under temporary protection in Turkey, most of their jobs maybe are not stable. So their job security is lower than the rest of the population. So that's the first thing. So if you ask them to obey quarantine or to telework or to social distance, some of the jobs that they hold, they cannot be done like we're doing now, through teleworking or using internet or using comfortable chairs. So these people have to go and work where work is. And if that's not possible, the first thing they'll do is they'll lose their job. And the moment that happens, it means that their families will suffer from a lower income than usual. And if that comes, so lower income, immediately it's translated in hardships related to food and shelter. So that's first. And then immediately after, hardships for health and sanitation. Now, so it's not a very good picture, but if you throw in a lower level of health literacy, and then higher unmet health needs, as I explained earlier, then also the other thing is that these households are usually twice the size of the regular host population households, which means that there is closer proximity and less chances of social distancing even within the larger families. And if you couple that with decreased access to proper hygiene and sanitation, for whatever reasons, then you can guess what the end situation in terms of pandemic will be. So obviously, the work that has been done by the Turkish Ministry of Health, it's great. So, Turkey has basically marked a large victory in terms of health diplomacy. I mean, they've managed to export PPEs to almost 200 countries, which is, I think, a very commendable thing to say. But if we look again at the continuation of the pandemic and the special needs that the refugees have, all of us collectively, we need to pay more attention on supporting. The support with health information has been great, but we still have room, I think, to supplement with provision of medical supplies for the refugee health facilities or PPEs. And I take the opportunity here to thank very much not only the EU, but also some of the EU member states who have worked with us and agreed to repurpose some of the existing funds to support the purchase and delivery of PPEs, not only for our 7 refugee health training centers and provinces where WHO supports. I mean, these are government facilities owned and operated by Sahat, but we provide additional support because of our training component, but also to DGMM. Quite recently, we, with support and approval from EUD and Elif Hanım and Libor Bey, we activated a contingency reserve, which is very modest compared to the rest of the means that Sahat or the Ministry of Health are putting in the matter, but we also try to help. And we provided support to 28 what we call removal centers for other migrants and refugees operated by DGMM. And very soon I will be sharing with our donor the evidence of that, which I received basically last night. So a big thank you to the donors, and a big sort of call to all the partners, including health professionals, to not put the guard down. So the pandemic is still around. There's still a lot of work to be done, and let's keep working together. So that's my input. Thank you.
Great, thank you very much, Altin. That's great. And just to add also what might be helpful in terms of the impact of COVID on refugees and migrants, we're now conducting a survey. It's called Apart Together survey, and it's looking at the impact of COVID on refugees and migrants. It's a global survey, so it covers Turkey as well. And it closes on the 15th of October. I think there is around 8,000 responses already. So hopefully that could inform as well interventions at country level, and we'll be sharing those results with you as well. So thank you everybody for your interventions. I would like to now hand over to the audience and sort of go for comments and questions. But before that, we already have a first comment intervention from Dr. Ahlan. So hello and good afternoon to you as well. Would you like to come in, Dr. Ahlan?
Hello.
Oh, Gamze. Hi, Gamze.
Hello. I would like to run very quick question and answer section.
Okay, please go ahead.
Yeah, I would like to thank our precious speakers and panelists. Firstly, before the closing of the webinar, we will carry out the QA part. The first questions are generally related to the Sıhhat project, and since they are not the subject of our webinar, so they are directly addressed to the whom in charge. And some valuable contribution, like from the attendees Mohammed Kattash in the chat section, he suggests that it will be effective if dentists are involved in migrant health centers. And one of the attendees, Diana Ismailova, mentioned that importance of the data and shared a research name, Vulnerability and Resilience Atlas in Tajikistan. And there are three main questions. First, I would like to ask the first questions to Hande Hacı Mahmutoğlu. Could you please inform us what about longer-term solutions for the integration of Syrian doctors into the health system in Turkey? For example, licensing processes of doctors or specialized doctors and professors in universities. Could I continue the questions or answer questions better? Yeah.
Let's take all questions and then we'll see who wants to react.
Can I make my remark, because I had to leave within 5 minutes due to our agenda about the investment program. I'm really sorry about that. The announced program was between 2 and 4 p.m. Regarding the question that you have mentioned, I guess Ministry of Health should answer because they're responsible for the licensing issues. We are responsible for the general health policies. If there is any question about the general health policies, you're very welcome by my side to answer it.
There were a question about feedback and data receiving from doctors and working with refugees on the ground. So how are we supposed to let know what we think and provide you with the feedback of you require? Does it really related with your subject or?
Is it something about the grievance policy of the health system?
Yes, kind of, and collecting data from the healthcare workers in the field.
Okay, this is also related to Ministry of Health as well, because they collect data from the ground.
Okay, then the questions for you is over. Thank you so much.
Sorry for this. I'm really sorry to leave this very beneficial webinar. And I would like to thank our moderator, Mr. Bartovic, and the other colleagues, the panelists, thank you very much for the very beneficial information that I have gathered from your speaks. And sorry again to leave, but I would like to involve in another webinar and like to receive the further ideas about the field. Thank you.
Joseph, can I ask 2 questions to the general floor then?
Yes, please go ahead.
Okay, I would like to ask to all speakers, what about longer term solutions for the integration of Syrian doctors into the health systems? Could you give any contribution about that questions, and how we can add the informations or data from the doctors or healthcare workers from field?
Yes, Amelia, and then anyone else who would like to.
Gamze Hanım,
Kanuni Bey, buyurun.
Gamze Hanım, müsaade ederseniz 1-2 soruya ben yanıt vermek isterim.
Mr. Kanuni, the floor is yours. Yes, if I may just answer a few questions then.
Teşekkürler, lütfen.
Thank you. Yes, please go ahead by all means, Dr. Kanuni Keklik. Can you hear me then? Can you hear me clearly?
Ben şu anda.
Evet, duyuyoruz.
Yes, we can hear you clearly.
Devam edeyim mi?
If I may continue, shall I
sorulara yanıt vermek istiyorum.
I'd like to answer
Kanuni Bey, hepimiz
questions.
duyuyoruz.
We're all able to hear you clearly, Dr. Kanuni Keklik. The floor is yours, sir, for you
Ben
to
şöyle diyeyim,
respond.
öncelikli olarak nedir?
First
Uzun
and
vadeli olarak
foremost,
istihdam
in the
politikalarına
long-term
baktığımız zaman
employment
tabii
policy,
biz bunu
once we take a look at
Avrupa
these,
Birliği'ndeki
we
arkadaşlarımızla,
focus
DSÖ'deki
on these
arkadaşlarımızla zaman zaman
with
görüşüyoruz.
our colleagues
Hani
from
bu
EU and
süreçlere
WHO,
dair nasıl bir
and
politika
what kind of
yürütülebilir
policy
diye.
could we be
Tabii ben şöyle
conducting
diyeyim,
with regards to these
Türkiye'de
processes of
biliyorsunuz hekimler
integration
üzerinde
of the Syrian
baktığınız
doctors
zaman
into the
temel bir
healthcare
kuralımız var.
system in
Türkiye'de
Turkey.
çalışabilmesi için
There's, for
bu
someone to be
hekimlerin
employed in
aslında
Turkey, all these
denklik
physicians, they need to
sorununu
have
çözmüş
their
olmaları
equivalence.
gerekiyor.
They need to have
Ama
resolved their
bizim
equivalence.
Suriyeliler için
And for
özel
the
bir
Syrian doctors, in order
mevzuat
to ensure
çalışmamız oldu
their
ve dedik ki bu
integration, we
insanlar
have
zaten
also
Suriye'de bu
prepared a very
hizmetleri
special
kendi
and
halkına
dedicated
yönelik veriyordu. Burada da kendi
preparation
halkına
of
vermeleri
draft of
kaydıyla
a certain
bir
regulation.
mesleki yetki verelim ve
And
bunu da
we
özel
wanted to
şartlar
give them a
içerisinde verelim
proficiency
dedik.
in terms of
Dünya
their
Sağlık Örgütü ile
professional
beraber bir eğitim
practice.
programı
And we
hazırladık.
have
Bu eğitim
prepared a
programını
training in
başarıyla
cooperation with
bitirenlere mesleki
WHO
yetki belgesi
for
verdik
those of
ve dedik
Syrian
ki
doctors,
göçmen
for those
sağlığı
Syrian
merkezlerinde
doctors who have
Suriyeli
completed
geçici
these
korunanlara
trainings
hizmet
we have
vermek üzere bu hizmetleri
coordinated with
verebilirler bu
WHO
arkadaşlarımız.
successfully.
Bu
We
birinci
wanted
boyutuydu.
to, and we
Böylelikle
have given the opportunity
bir
to be
sorunu
employed
çözmek amacı
at the
güttük. Sebebi de
grounds for the
şuydu.
Syrian
3
doctors. We
milyon
wanted
600
to
bin
address, for
üzerinde
instance,
Suriyeli
more than
geçici korunan
3.6
vardı ve bu
million
insanların dil ve
temporary
kültür engeli sebebiyle
protection
hizmet erişiminde
Syrians
sorunlar
we
vardı.
have
Bu
with the accessibility
mevcut
problem to
şartlar
the healthcare
içerisinde bir
services. So
çözümdü. Ama
this was the
geldiğimiz
kind of
noktada
solution
tabii
that we
ki
were ready to provide
uzun
as a
vadeli
solution. However,
dönem
as a
uzun
long-term
vadede bu
solution,
sorunu nasıl
this
aşarız
how could
konularını
we be
çözmeye
overcoming this problem
çalışıyoruz.
in the
Fakat
long term? We're still
bu
working on
konu
it. But
biliyorsunuz sadece
as you
Sağlık
may know,
Bakanlığı
it's not
düzeyinde
only at the
değerlendirilerek
level of
çözülebilecek bir
Ministry
sorun
of Health.
değil.
It is
Bu
not a
çok
question that
taraflı
needs to be addressed at the
olarak bir
Ministry
araya
of Health
gelinip
only.
çözülmesi gereken
It
hususları
requests and
içeriyor.
it
Bunun bir
requires
tarafında
an approach that
işte
is
Yüksek Öğretim Kurulu
multi-sectoral and
olmak zorunda çünkü
multidisciplinary. For instance, we need to
denkliklerle
have the
alakalı problem
High
mevzuatımız
Council of
içerisinde var.
Education in
Bir
terms of the
tarafında tabii ki
resolutions
Göç
that needs
İdaresi
to be
Genel Müdürlüğü
introduced to
mutlaka
the
olmak
question
durumunda.
of
Çünkü
equivalence,
statü
and the
tanımlarında bu genel
DGNM
müdürlük
needs to
İçişleri
be
Bakanlığı
involved
dolayısıyla
because
bu
of the
işin
Ministry of Interior
içerisinde yer
Affairs,
almak
because they
durumunda.
need to be
Çalışma Bakanlığı bir
involved, and the
tarafında olmak
Ministry of
durumunda
Labor
ve tabii
that
ki
needs
Sağlık
to be
Bakanlığı
involved, and
bu işin bir
also
yönünü
including Ministry
teşkil
of
etmek
Health.
durumunda.
Ministry of
Şimdi
Health
biz
will
geldiğimiz
be also
süreçte
there
bütün
within the
bu
team
konuları çalışarak belli bir
of
noktaya gelmek
coordination,
istiyoruz.
and
Tabii bu
we'd
arada
like to, we're aiming
ilgili
to reach
kurumlar
to a
aslında bazı
certain
düzenlemeler de
level
yaptılar. Mesela
by
puanları
means of
düşürdüler
having an
ve
involvement of
denklik
these stakeholders. And
sınavlarında başarının artmasına
some of the
yönelik bazı
points
girişimler
have been
oldu. Fakat takdir
reduced
edersiniz
down
ki bu
so that
yeterli değil.
the success
Biz
level
bunun yanında
can be
Sağlık Bakanlığı
higher. However, this is
ve
not a sufficient
burada DSÖ'yü de
step.
zikretmem doğru olur.
And
DSÖ
not
ile
the
birlikte
Ministry
şunu
of
da
Health
yapıyoruz.
only, but also with
Sınavlardaki engellerden bir
WHO.
tanesi de dil
One of the
engeli
barriers
biliyorsunuz.
in the
Dil engeli olduğu için bu
examinations,
dil
as you
engelini
know, is the
gidermek üzere de
language
şu anda bu
barrier.
çalışma
So
yaptık
we are
ve
also
başlattık.
addressing the
Ve bütün
language
bunlarla
barrier related
beraber
problems
işi
so that
yönetiyoruz.
the language issue can be resolved. As far as I know, the EU, in line with the directions from the EU's direction, the WHO will be carrying out an analysis as to address the details. And I'm sure there will emerge to the surface some ideas as to how best to solve the language barrier issues. And I understand, I believe that all these will be resolved. Another question was about the sharing of the experience. Yes, Dr. Kanuni.
Durum içerisinde ilgili
situation,
sorumlu yöneticiler nezdinde illere yazılı olarak vererek arkadaşlarımız bu tecrübelerini bize iletebilirler. Çeşitli webinarlarla bir araya geliyoruz zaten sahadaki arkadaşlarımızla.
the experience they have gathered on the ground. Maybe they can just bring it to a document and they can share it with us. We know that we sometimes meet here through these online webinars. Maybe we're delayed on that a little bit. However, we wanted to we have employed a separate communication expert in our project with whom we are trying to disseminate the information so that every information and communication is out there through which we're hoping to establish an open communication field for each and every one of us. Thank you so much. Thank you sincerely for your valuable contribution. One last question. I will be asking that in English.
How to develop communication with workers on the first lines of doctors, nurses, and health personnel, and the periodic evaluation of negative effects on workers. To Emilia Aragon.
Because it's in English, I'll attempt to respond, or at least lead the discussion.
Go ahead.
Please, Malaj.
Okay, thank you very much for the question. I would assume that if we're talking about doctors and nurses, then this discussion is very clear. So they're hired by Sahat 1, and there are mechanisms for which we can use to basically filter all the feedback in, based on their activity through, either head doctors or other, provincial health authorities. Specifically only for 7 refugee health training centers that WHO is partially supporting together with Sahat. We also have an additional support structure. We have also facility managers and other, additional stuff, which you would not find in all the refugee health centers. But because of the special function that these training centers have, more stuff is available and more support is available from the operations. So for our 7 facilities, there is also a position of the facility manager, which can be used to collect information or collect obviously feedback of whatever issues or whatever problems that we might have health professionals at the front lines. Now, of course, there are other mechanisms. I know that we have throughout and I say we, including myself in the Sahat network. So there are other mechanisms of including, complaints or ideas or impressions, either through comment box or complaint box in the facilities or other mechanisms. And of course, there are also other ways of trying to, share those concerns. One forum might be whenever we meet for the, trainings or for, other training activities, be it, on one topic or another, that points of contact can be done with the provincial health directorates and then Ministry of Health and then all the other partners, including WHO for those 7 centers. And of course, we all talk to each other. So there might be a way of hearing the concerns or the questions that we might have. But ultimately, the system is one, so it should operate, with a very clear command and control center. So the Ministry of Health owns and operates all the health centers, under the Sahat. So as a start, and then we can discuss in more detail. Over.
Great, thank you, Altin. Thank you, Gamze, as well. Is that the last question?
No, there are no any other question on the floor. Thank you, Joseph.
Okay, thanks a lot. I know, Emilia, you had a hand up. Did you want to come in as well? Please.
I just want to say something really short. I think I can see the appetite for participation and engagement, and that's actually very good. A very good sign of people still motivated to make a change. And in that sense, I heard from Altin so many of the mechanisms that are in place for people to express and participate as well. And that's very, very good to hear. And there's one framework that has been already created also around like how can we engage people, and there's different levels of engagement, and we need to know also which ones in which one we better fit. And there's ways of informing, there's ways of consulting, there's ways of empowering, there's ways of making partnerships. And I really see this, for example, this forum as an opportunity to open those floors as well and empower people as well. And it's really nice to hear that appetite for participation. So it was just that comment in the end. So thanks.
Great, thank you, Emilia, and thanks for being with us. Dr. Ahlam, would you like to come in as well with an observation? I know you have wanted to say a few words. Please go ahead.
مرحبا. أسعد الله مساءكم جميعا. لكل المشاركين، نحن هنا نتكلم جميعا عن التنمية المستقبلية والأهداف اللي وضعناها وكم حققنا من الأهداف التي وضعناها. أنا كوني كطبيبة ورضع وحديثي الولادة أعمل في مركز صحة للاجئين في أنقرة. أكلمكم كيف بخطوات واثقة في
working in Ankara Migrant Center. And the most important issue here is to have the cohesion for the refugees. And also to address the health problems of the refugees.
المركز التعليمي الصحي للاجئين في أنقرة تم تجاوز هذه العوائق.
So we need to overcome the obstacles, especially for the health and education services for the refugees. We try to establish a group of health workers, including nurses, physicians, and we try to provide active participation. And unfortunately, the quality of the sound is not very clear in Arabic. That's why the translation will be very brief and short. Unfortunately, there is a delay in the sound, so the interpretation is not provided very well. In the future, we'll do our best for providing these services. And of course, we have the problems, obstacles, but we try to apply the programs. For example, there could be the need of using some specific medicine, especially for some specific diseases. So there needs to be the follow-up, etc. So we try to provide all those services. And we have mother and child follow-up programs we try to fulfill them as well. Of course, the development of the children is very essential for us, and it is a very important topic. Therefore, we try to pay more attention to this field. In this sense, I believe we have specific accomplishments. And also we provide consultation for some specific diseases.
وعندنا عيادة خاصة لمتابعة الحمل.
So we also provide the follow-ups for the pregnant, and we try to provide the services until the end of the pregnancy.
Great, thank you, Dr. Ahlam. Thank you very much for this intervention. I would like to, just in the interest of time,
we have a special clinic as well.
Sorry, And
also regarding nutrition, especially for healthy nutrition.
I have to, I'm getting instructions from organizers that I'm afraid I have to interrupt here. So thank you very much for this intervention, and it's great to see how things are actually really filtering down. I think during this webinar we've seen it from the very central level, from actually the organizations or institutions, national institutions that are in charge and that are really taking the leadership for the SDGs, all the way down to healthcare workers and people who are working in the field. So thank you very much for your contribution. And I'm happy to say also that it doesn't end here. We're bringing this webinar to a close, but as we've said at the beginning, there will be a report, there will be a concrete output coming from all the interventions, which we will share with all the relevant stakeholders who are participating today. And hopefully this will contribute to the advocacy around SDGs and advancing SDGs in Turkey going forward. I think we have identified so many entry points during the course of the afternoon, from the universal health coverage to sort of building really strong institutional architecture for SDGs, to, as I said, all the way down to some of the local implementation and processes where we can all engage. And also would like to bring it back to the presentation from one of the speakers in the webinar. We're talking about the responsibility, and that actually everybody has a responsibility for implementing SDGs. So as citizens and as responsible citizens. So that's really my my 5 pence worth of conclusion. As I said, it doesn't end here. Thank you very much all for participation and for engagement, and we'll be in touch with all the resources we have promised to upload in the library, and also with the report. So thank you again, and very good afternoon, rest of the day to everybody. Bye-bye.